because maybe you got a blockage here, okay? Things that can go wrong with the gallbladder. You can get stones in the gallbladder, common bile duct. Incidental or associated with cholecystitis or cholangiohepatitis, okay? And in that case, they're vomiting, anorexic, have icterus fever, and abdominal pain. And usually this is old, small breed female dogs or middle-aged to old male cats, okay? So small breed, old females, and middle-aged old male cats. Sodium or radiopaque ultrasound is usually the imaging of choice. Labs can be normal to abnormalities consisting with extrahepatic biliary obstruction, namely ALT, ALP, and bilirubin elevations, maybe GGT. There's not really much medical treatment to be done. You really need to remove it. Okay. Next item for gallbladders is mucus seals. Okay. We don't really know why or how they happen, but they do. You have a dysfunction in the mucus secreting cells of the gallbladder. It's increasingly common cause of extrahepatic biliary obstruction in cats. You can have rupture of the bile, rupture of the bladder with bile peritonitis, and that's fatal. That's an emergency. Got to get to them right away. These occur in H dogs of both sexes, and you're talking this group of small breed dogs. Looks like small. That's a herder. I'm not sure what a cocker spaniel. I think it's a hunter. Okay, Shetland sheepdogs, cockers, and scousers. Abdominal discomfort, depression, icterus, tachypnea, fever, or tachycardia. Okay, diagnosis with ultrasound, and labs indicate extrahepatic biliary obstruction. Rising lactate if rupture and peritonitis. Okay. Lactate is a good indicator for prognosis for a lot of diseases, GDV, peritonitis, so on and so forth. We ran a lactate on the peritonitis case I did Friday, and it was 2 point something. So. Medically manage these guys with urodeoxylic acid. Actigol, I think is the brand name. Acetyl L-methionine, that's SAMe. Antibiotics, and asymptomatic, if asymptomatic or until surgery can be done. Bile peritonitis, acute abdomen due to leakage of bile into the peritoneal cavity. It's very irritating, okay? You want to treat them medically as to conditions, so fluids, electrolytes, antibiotics, whole blood transfusion, it's lethal. Early diagnosis is critical. Repair or create a biliary diversion or removal of the gallbladder / duct and open abdominal drainage. The prognosis is guarded. So that's why I did not want to touch that thing in that dog's abdomen. Understandable, right? Yes, yes. Okay, so I'll give you back some time that some others have taken away from me, but I'm going to hand out your medical records first. One person and one person only come up from each group. Get these back to your bins. I got new folders I'm going to put down there. Keep your folders in order. Group 1, Group 2, Group 3, Group 4, so